Hi everyone, Dr. Remy from Pain Free and Fit and Posture Size. Today we've got a great exercise for those of you with Facet syndrome known as the split stance Sumo posterior pelvic tilt. Hope you enjoy. So many people with Facet syndrome of the lower back are aggravated because of a condition known as an anterior pelvic tilt, where the pubic bone is lower than the tailbone. People with spondylolisthesis also many times have this problem. You can check that by putting one finger on your pubic bone, one finger on your tailbone, and looking in the mirror. If your tip of your tailbone is higher than the pubic bone, you have an anterior pelvic tilt, and this exercise may certainly help with your Facet syndrome pain in your lower back. The facet joints become more compressed together and jammed when that tailbone becomes higher than the pubic bone because the arch in the lower back, the lordosis, is increased. Many times with Facet syndrome, one of the complicating muscular imbalances that leads to that anterior pelvic tilt is tight hip adductor muscles. That's the muscles on the inside of the thigh. Chronic postural problems like crossing the legs, sleeping with one knee in front of another, have a tendency to tighten these muscles over time. And if we don't get enough of the proper movement or postural positions, these muscles stay tight. And some of these muscles attach to the front of our pubic bone and pelvic rim that causes the tailbone to come up and the pubic bone to go down, aggravating Facet syndrome. So you can check this in yourself by putting a hand in your lower back, and as you stand in a normal stance, start to widen your stance. And the wider you go, you'll notice that that arch in your back, if you have tight hip adductor muscles, will start to increase. It'll be harder to hold the tailbone under. People that have a anterior pelvic tilt need to posturally hold an opposite direction called posterior pelvic tilt, where you swing your hips so that you tuck your tailbone under and pubic bone up. Your abdominal muscles do that as well as your hamstrings. And as you posterior pelvic tilt with the feet together, you'll notice it's pretty easy to do. But as you hold that and bring your legs further apart, it's much harder to do if you have tight hip adductor muscles. You'll feel there's a tendency for that pubic bone to go down. If that's the case, this exercise is for you. Now, as opposed to people with straight spondylolisthesis, where the bone is forward, that we've taught this video series before on our channel, this exercise is targeted to Facet syndrome because most Facet syndrome patients also have a complicating factor of rotation. Besides the extension or increased arch in the lower back, many times there's a rotation or a twisting pattern that aggravates those facet joints. So this exercise, the way we're going to do it today, is we're going to tuck our tail under to a comfortable degree. Again, if you go too much tail under, you're going to feel a little pulling in the back, and you're going to mark that position as one extreme of motion. And then you're going to raise your tail up till you feel a little irritation in your back. That's another extreme of motion. So you want to position the tailbone halfway or a midpoint between those two. That's your neutral spine in terms of posterior pelvic tilting. There's more to holding your spine in the correct position. You can learn that on our other videos on neutral spine position here on the channel or at the painfreeandfit.com website. We have a free body analysis to learn what postural issues and mechanical issues and muscle stability issues in your lower back and hip regions may be aggravating your Facet syndrome. But for now, we're going to tuck that tailbone halfway between those two extremes, and then we're going to start to separate our legs. And you're only going to go as far as you can till you feel a mild pull or stretch on the inside of the thighs, or until you feel difficulty in keeping the tailbone tucked under. At this point, what you're going to do is you're going to move one foot slightly forward from another. That introduces a rotation or twisting of the pelvis. Typically, what it does is it causes the pelvis to want to twist away, have your pubic bone twist away from your front leg. So you'll need to hold your pubic bone towards your front leg to remain straight. This will also increase the flexion effect on the back leg. So from this view, let's say I had a tight hip adductor muscle on the left side. And when I put my tail under and separate my legs, I feel a little bit of a pulling there, or I may feel a challenge with holding my lower back in that neutral position. What I want to do is I want to bring my right leg forward a little bit, and that's going to increase, as long as I hold my tailbone under and don't let that move, it's going to increase the stretch effect of those hip adductors, especially the ones that are contributing to a hip flexion effect, which cause that tailbone to tilt up and that pubic bone to tilt down. And I'm going to hold that position. I'm only going to bring my leg forward enough to feel a mild pull. If I feel a major pull, I have to back that leg up a little bit. And as I hold the tail under, I'm going to maintain that stretch until that leg muscle starts to release. That's a great stretch, and it's a great isometric practice for the abdominal muscles to maintain that position. So you're getting both the stretching effect with this exercise and a strengthening or endurance effect of the abdominals all in the same movement. Now, one other key I want to point out with this exercise that's huge for people with spondylolisthesis as well as Facet syndrome is many times people have a tendency to turn their foot outwards when they walk or they stand. That's called an external hip rotation. Most of the time that causes a hip hike or elevated hip on that side and a resultant torso side lean, which compresses the facet joint, aggravating it on that side. So if you have a tendency to walk or stand with, let's say, your left leg out, that leg is more likely to have those tight hip adductor muscles. That's the side we want to focus on keeping back. If you have tight hip adductor muscles on both sides, you'd want to focus on the opposite side back first and end this exercise with the involved leg or the external rotated leg back. That will serve to end your routine in a corrective direction where that left leg, the tighter hip adductor muscles, are more stretched, leaving you in a more correct position. If you like this exercise for Facet syndrome on posterior pelvic tilting, I invite you to subscribe to the channel. We got a lot of great exercise videos out there for Facet syndrome to help you both in the low back and the neck. If you'd like to help me share this valuable information with others, give me a thumbs up below. If you have questions or comments, please write in. I will do my best to answer them. You can also plant the seed in terms of what you think you'd like to see on our channel. That's where I get the seeds for my next videos. If you're looking for a tailored specific program for your Facet syndrome case, go to our painfreeandfit.com website. We've got the Fast Track program for Facet syndrome. It's a great program that teaches you full body analysis, how to do unique stretches, targeted coordination exercises, how to find neutral spine, spinal stability, how to engage the right muscles in the right way, and a whole conditioning program to take you from the basics of pain relief exercises all the way through a conditioning program to help hold your Facet syndrome stable so you can participate in sports and physical activities again, as well as working out for fitness without hurting yourself. I hope you've enjoyed this exercise on the Sumo split stance posterior pelvic tilt to help with Facet syndrome of the lower back, and I hope it helps with your chronic lower back pain.